Mr. Speaker, in 2007, the Paramedic Association of Manitoba released their Quiet Crisis Report on the situation of emergency medical services in Manitoba. 6 years later, a report in 2013 on the emergency medical services in Manitoba described a situation that was continuing to be so bad that a basic patient care record program was removed and never replaced. Still today, only Winnipeg has the EPCR. And after 2 years after that report, we hear that only one of 54 recommendations has actually been implemented. What has today's NDP government been doing instead of attending to the urgent needs to improve our emergency medical services in Manitoba?
Thank you, Mr. Speaker, for the question. For the record, in 1999, there were 280 paramedics in Manitoba. How many are there today, Mr. Speaker? 1,500, a dramatic increase. In 1999, in terms of advanced care paramedics, Mr. Speaker, there were but 7. Today, we have 180, Mr. Speaker. 180. In 1999, 80% of the paramedic workforce were casual or volunteers, some excellent people working very hard to do the job, Mr. Speaker. Today, 70% of the paramedic workforce is full-time employees, Mr. Speaker. Those are very significant increases in resources, Mr. Speaker. And I can say this, the Emergency Dispatch Center in Brandon has been completely rebuilt and outfitted with modern technology. Right. The fleet of ambulances throughout the province, Mr. Speaker, has been modernized and updated and outfitted with GPS technology, Mr. Speaker. We have made very significant investments in paramedic services in Manitoba. The numbers speak for themselves, Mr. Speaker.
Is it working, Mr. Speaker? The 2013 report was very critical of the variation in services and the lack of provincial oversight. The large salary differential between rural and Winnipeg paramedics is creating major inequities and problems.
Big issue.
On page 14 of the report, it is blunt, and it says there is no accountability.
None.
Can the Premier explain to the legislature why in 16 years of today's NDP government, there is still no standardized approach to the reporting of critical incidents and near misses in the work of paramedics throughout the province? This is vital so that problems can be identified and improvements made. Why is it not standardized? Why is it not easy to do all over the province?
As I said earlier, Mr. Speaker, we've gone from 280 paramedics in Manitoba to 1,500, from 80% casual and volunteers to 70% full-time, Mr. Speaker. A new fleet, new dispatch mechanisms, Mr. Speaker. And critical incident reporting, Mr. Speaker, never existed under the members of the opposition, Mr. Speaker. They didn't have a critical reporting incident system in Manitoba. We have that system now. That system provides information on how to improve healthcare services. It is a very important part of the process, and we always look for ways to continue to improve that system so we can offer better quality services to people everywhere in Manitoba, Mr. Speaker.
Mr. Speaker, for paramedics, the system is not working properly. In the 2013 EMS report conveyed concerns about long shifts and the risks of individuals being overly tired. Yep. In fact, the problems with the whole system are so severe and so far-ranging that the mental health status of paramedics and the lack of available psychological support has become a major concern.
Crisis.
Yet little action has been taken to ensure the health and safety of our overworked paramedics is paramount. Why has the Premier and today's NDP government done so little to address the major problems that were unearthed at the time of the EMS review and before that in the Quiet Crisis Report of almost 10 years ago?
Mr. Speaker, 80% of the workforce is full-time now, Mr. Speaker. In 2012, in response to concerns about paramedic fatigue, everybody was brought together around the table, Mr. Speaker, and that included the paramedics themselves, their unions, and regional health authorities, and they agreed to work together on how to improve that situation, Mr. Speaker. I note for the record, we are bringing in legislation announced in the throne speech for post-traumatic stress disorder, Manitoba, Mr. Speaker, to cover frontline workers, but we believe, most importantly, in prevention, Mr. Speaker. We believe in prevention. We believe that we can do things in partnership with the people on the front lines to reduce fatigue, to increase their capacity to provide good services, and we make that commitment and will continue to work with them to do those things that will improve the quality of their work and their ability to respond effectively to the public, Mr. Speaker.